Hi everyone, I welcome you to my channel on Cardiac Essentials. This is Dr. Shri here. So today we'll be talking about carotid artery and what is and the plaque buildup. What is a soft plaque in the carotid artery, and is it dangerous buildup of fat? What is it? So many come up to the hospital saying that they are not able to swallow, or sometimes it's like a slurry speech. So one might be wondering like what's causing all this. So the first thing doctors think is, okay, they send to labs to do the ECG and echo, but if presented to a neurosurgeon, he might be the most right person, I would say, to come up with the plaque in the carotid artery, which is the soft plaque is in the carotid artery is a dangerous buildup of fat, cholesterol, and fibrous tissue, often with hemorrhage, making it prone to rupture and causing a stroke. Unlike the real hard plaque, calcified plaque, So mostly while you are focusing on aggressive risk factor control, so it is your diet, what you take, your exercise, and no smoking, and the statins to stabilize and shrink it. The most important thing is sometimes blood thinners like ecosporin. The aspirin is given along with statin, say like Crestar or rosuvastatin, 5 mg or 10 mg, even sometimes 20 mg to shrink it, preventing clots from blocking blood flow to the brain. So now you might be wondering what is the composition of this soft plaque. So these are nothing but they are high in lipids, that's the fat, and necrotic core, the dead cells, and blood, intraplaque hemorrhage, and considered vulnerable or high risk. Why do we call it high risk? Why is a soft plaque called at highest risk comparatively to the calcified hard plaque? Because it's unstable and there are more chances for it to rupture, and when it ruptures it leads to a clot formation and sometimes leading to stroke. When there is a complete block blood supply to the brain, that's when it results in stroke. So when you do like a CT scan or a ultrasound of the carotid artery, it appears as a low density area on the CT scan and shows specific signals like a high density on MRI indicating hemorrhage, or the lipid what do we call it, call as a lipid content. So what are the risks? The major danger is plaque rupture when you are talking about a soft plaque. Why? Because it can trigger clots that can travel to the brain. So when the blood supply to the brain is being blocked, then it can lead to stroke, So we call it like a TIA, stroke syndrome. So what are the symptoms of this? Symptoms are like numbness, it might be the arms or hands or feet. So it might be like often symptoms like numbness, vision changes, or weakness appear only when there is a stroke or TIA, that is a transient ischemic attack, as the brain isn't getting the proper blood supply. So now you might be wondering, Dr. Shri, we have been talking about this, how do we treat it? So it depends again. If it is a soft plaque, we would recommend you to immediately go to a cardiologist and get treated, because it's very dangerous to leave it untreated over time, as it can grow and it can completely block the blood supply to the brain, leading to a stroke. So simple lifestyle modifications can help, like stop smoking and avoid like low health. Stick on to a healthy diet. Like don't take too much of cholesterol or too cheesy food. Take like low saturated food and get in with regular exercise. Maintain healthy, but I would suggest that you, as soon as you come with the diagnosis of this, please don't delay. Go meet a cardiologist because he can draw up a plan for you. And statins are a must along with blood thinners. That's what they prescribe, like a Lipitor or a Crestar, depending on 10 mg to 20 mg, depending on the size of the soft plaque that's being found in the carotid artery, or the major key to lowering the LDL cholesterol and shrinking plaque. Then again, you one more risky factor is you have to control your high blood pressure and diabetes. So interventions are like for severe narrowing procedures like surgical removal, carotid endarterectomy, they say, or stenting might be considered. But stabilization with drugs is often the first goal. Depends again on the size, like how you are, what is the size of the soft plaque, like if the soft plaque is a lesion containing fibrous, what is it? Like we discussed before, it is nothing but a fibrous tissue, maxomatous tissue, calcification in less than 50% of the plaque area with the highest rate of stenosis. So non-soft plaque are often defined as plaque that contains like a fibrous tissue, maxomatous tissue, or calcification in 50% or more of the plaque area. So we might be wondering, what is the, it is very serious. Once you come up with the diagnosis, please don't take it light or delay on saying that, okay, I'm taking my regular heart medications. Don't do that. Consult a cardiologist as soon as possible, because when the plaque is lower in size, say less than 2.8 mm, less than 50%, like it is easily curable with treatable with medications. But as long as you leave it untreated and the plaque starts growing, then it becomes a problem. So prevention is better than cure, they say. So what is the treatment for soft plaque in arteries? So there are many medications which are available in the market to treat coronary artery disease, including cholesterol medicine. So your cardiologist might prescribe some medicine to lower the bad LDL cholesterol to reduce the plaque buildup in the arteries. So what are these medications? We all know we are talking about statins, niacin, fibrates, and bile acid sequestrants. So now you might be asking a question, what is worse, soft plaque or a hard plaque? So non-calcified plaques are not as prone to rupture as low density plaques, but can still cause a rupture or blockage in the arteries if left untreated. So calcified plaques are the least likely to cause a rupture or blockage, as they are more stable than soft and low density plaques. So it's very dangerous. I suggest that you should go see, once you come to know through ultrasound or imaging that you have a soft plaque in the carotid artery, please don't neglect it. Go see a cardiologist as soon as possible to avoid any future complications. So there is increasing evidence to suggest that unstable inflamed carotid plaques could rupture any time, causing stone irrespective of the degree of stenosis. Okay, so you have to be really careful when you're talking about plaque in the carotid artery. So some time ago, a patient had come with a question asking like, how long does it take for soft plaque to form in the arteries? So plaque buildup takes many years, even decades, but as your arteries narrow, you might notice like some mild symptoms, and these symptoms mean your heart is pumping harder to deliver oxygen rich blood to your body. So now you might be asking, what do we mean by that? So one of the most important aspects in the treatment of patients with symptomatic non-stenotic carotid plaques, or is how the depends on the severity of it. Like, so if you're talking about the current guidelines, it relies on the measurement of the degree of stenosis to recommend carotid revascularization. However, there is increasing evidence to suggest that unstable inflamed carotid plaques could rupture anytime, causing. So you have two carotid arteries, one on each side of the neck. There are large arteries that bring blood to your brain, face and head. When they are healthy, these arteries are smooth and open, and there is a free flow of fluid without anything in the way. So the body's circulatory system is a network of tubes. It's like a network of tubes that carry blood containing high nutrients and oxygen to all parts of the body to function properly. So when one develops carotid artery stenosis, which is located in either side of either of the two arteries in your neck or in both, this condition can worsen over time without medical care, leading to stroke with severe complications that can even lead to death. So please be careful, do not neglect it. So even little bit symptom of numbness, or if you're not able to speak, or if there is a slurry speech, numbness in the hands, take a echo ECG, and also your carotid artery, have a like ultrasound of the carotid artery to find out if there is any blockage, and if it is so, please attend to it. Please tune up to my videos to know further on it, and wishing you all a long and healthy life. Thank you and God bless.